I also wanted to ask you first about the role of blood sugar because that also gets elevated when we're stressed and obviously can cause a number of problems. And that's obviously related to insulin resistance and a reflection as well of how insulin resistant we are. So yeah, I guess what's that link between stress and blood sugar?
A major link, cortisol causes itself diabetes if you give it at high doses for a long time. But basically, what happens is this: when we're young and we're exposed to stress and we become overweight or obese, we can tolerate the high cortisol by increasing insulin. That's what insulin resistance is. And for a while, we manage to keep cortisol normal. However, as things are getting worse and worse, as we gain more fat, especially fat in the abdomen, visceral fat, and we lose muscle mass, skeletal muscle mass, then we become more and more vulnerable to become diabetic. Why? Because the beta cells of the pancreas that secrete insulin are somehow exhausted. They can't manage it anymore. So they start producing less insulin. So less insulin on one side and high cortisol production on the other by the liver leads to hyperglycemia. If that
Sorry, is it is
hyperglycemia,
it is it high cortisol or also high glucose?
high cortisol causes high glucose,
Right.
but not for a while because our pancreas can compensate. When we're young, for example, an obese child or an obese adolescent frequently has very high insulins because he is insulin resistant, but normal cortisols. However, as that person gets worse with age, as they gain fat and they lose muscle, the result is that the beta cell cannot manage it anymore. Unquote, it's exhausted. It's
Yeah.
not really exhausted, but it's a good simile.
I
And
guess that's why it's really important as you grow older to keep that muscle mass stable by making sure
absolutely,
you still do some weight training rather than just aerobic
exactly. You
exercises.
have to keep fat mass down and muscle mass up. And there are two ways to do that: good nutrition and exercise. Not too much exercise, moderate exercise.